Hi, I'm Julia and I'm with the Better Way Back team. The Better Way Back is a patient support and education community dedicated to supporting patients who are medically indicated for a spinal fusion procedure called XLIF. The Better Way Back supports these patients preoperatively, through treatment, and then also through recovery after spine surgery. Patient ambassadors are the heart of our program. There are postoperative patients who are volunteering their time to share their stories with preoperative patients. Patient pairings are when a patient ambassador speaks with a preoperative patient about the surgical experience, thus providing that invaluable patient experience and offering the patient hope as they're considering XLIF surgery. Today we have two patients, Alexandra and Sandy. Alexandra was a preoperative patient who spoke with a patient ambassador, Sandy, before and after her surgery. Their stories are very inspiring and I hope you enjoy them today.
My life before surgery was miserable, and I couldn't even walk from my car to my office to the elevator without having to sit down. I mean, the pain was so severe, and I'm used to hiking, I'm used to working out, I'm used to swimming. I couldn't do any of that. I was scared. When I was first recommended for spine surgery, it was my second one. So I've had one before where I was in the hospital for 13 days. I couldn't do anything for 6 months. I couldn't drive for 3 months. And they went in through the front and the back. So I was absolutely miserable with that one, and I swore I would never, ever have another surgery. So when Dr. Bawa mentioned surgery was the best answer, he had to go over in detail, a lot of detail. And he told me it wouldn't be as invasive, I wouldn't be in the hospital that long. And I said, can you commit to that? Can you really? And he said he couldn't 100% promise, but it would be a different experience. I spoke to several patients that had this surgery. And one of them is active like I am. I mean, she golfs, she does everything. I was just like, okay. And she said she was out of the hospital in 2 days. And it was everything she could do to hold herself back from doing things that we're used to doing. So she put me at ease, and then I called her again a couple days before the surgery and asked her if she was sure. And Dr. Bawa's warmth and his confidence really, really added to the ease.
When I spoke with Alexandra, I was thinking about having the surgery. She was very hesitant in the beginning about it, but she was living with incredible pain. And I think she was just afraid of it. And I hope I put her, fears to rest. And I spoke with her one time after, and she was pretty good about all of it, and had made pretty much the decision that she was going to go ahead with it. And I believe she was very pleased. I became an ambassador because I think it's really important that people can reach out to other people who have gone through the experience. And I also believe in the adage of pay it forward. And I think that that's very important for people.
The Better Way Back team supported me before and after the surgery. The information they sent me beforehand was very detailed, and I looked them up online, everything. And afterwards, when I hit a bump, and I was out of the hospital in 1 day, but when I hit a bump or I felt, and it was only the first couple weeks that I felt like I was hitting a bump. They just say, you're gonna be fine. You're already doing better than most. And they just called on a regular basis to check on me. It made me feel I was cared about. It made me feel like I was a team. Well, I'm back to being able to walk a mile, 2 miles, however long I want to walk. Up until today, I had to wear a back brace. So yay, I'm out of that so I can start swimming. But even with the back brace, it wasn't even a month after my surgery. Christmas time, I was able to walk all over San Francisco. I definitely feel I owe something, and I would want to be an ambassador and help anyone that was scared or was frightened of doing this surgery. I've had both experiences, both types, and this result is as good, if not better, than my first surgery. And I just wouldn't hesitate to help someone if they were scared.
So I choose to do the XLIF procedure because it's a newer, more minimally invasive way to treat lumbar disorders of the spine. There are many patients that have narrowing pressure on the spinal nerves and stenosis, which causes intolerable back pain and causes pain radiating down the legs and difficulty walking. So the XLIF procedure is an indirect way to open up that space and take pressure off of the nerves, and it provides a minimally invasive way to do that so that patients don't have to stay in the hospital as long, and it's less painful because it's more muscle sparing compared to a traditional back surgery or traditional lumbar fusion. So the Better Way Back program is a one-of-a-kind program. It's the only program that I know of where patients have direct contact with other patients. It's completely a different perception from a patient's standpoint of undergoing a procedure compared to hearing about it from a physician or a doctor. I can explain the program, I can explain the procedure 100 times, and it's going to be different from the way a patient experiences the procedure or feels going through the procedure. So I think it provides invaluable information for patients to share with each other about the whole process and the pain associated with it, or the lack of pain, and kind of the process and the recovery. So it's really a one-of-a-kind program that no other procedure has. So I think the Better Way Back program improves the level of care that we can provide to patients because it provides them with a deeper understanding of the whole process. Surgery is a very scary process, and for every patient, it's the most important thing that's happening in their life. Even though I discuss it with patients every day, 20 to 30 times with different patients, for them, it's the only thing that they're worried about. They're not worried about what's happening with their dog. They're not worried about, what's going on at home. They're just worried about what's going to happen with surgery. So the Better Way Back program really provides an invaluable way for that patient to really discuss the experience with another patient.
Would I recommend someone to the Better Way Back? I already have.